You know, um, when you think about cutting-edge skincare, you usually picture, like, pristine laboratories or synthetic peptides, right?
Right, yeah. Or maybe some highly calibrated laser treatments.
Exactly. Lasers, chemical peels, that sort of thing. You definitely don't usually picture a salmon swimming upstream.
No, you really don't. It sounds a bit like a joke, honestly.
It really does. But right now, one of the absolutely most sought-after regenerative treatments in aesthetic medicine involves taking DNA-like, extracted directly from the sperm cells of salmon, and injecting it straight into the human face.
Yeah, I know it sounds like a bizarre internet rumor or some wild social media trend, but it is very real. And the clinical data backing it up is actually incredibly robust.
It's crazy.
It is. The regenerative results are causing a massive shift in how dermatologists even approach tissue repair these days.
But I mean, anytime you take biological material from a marine animal and just, introduce it into your body, you are walking a very, very fine immunological line. So welcome to this deep dive.
Glad to be here for this one. It's a fascinating topic.
For sure.
Yeah.
Because today, our mission isn't just about the aesthetics of this trendy treatment, which, by the way, the internet has affectionately dubbed the salmon sperm facial.
A catchy name, if slightly alarming.
Right. But we are zeroing in on the rigorous clinical science behind it today. Specifically, we want to know what specific clinical screening protocol evaluates fish or seafood protein allergy risks before a doctor ever lets a needle touch your skin.
Because, as you'll see, your immune system is a formidable, heavily armed gatekeeper.
Right?
And trying to bypass its defenses requires an incredible level of precision and a lot of screening.
So to get to the bottom of this, we're pulling from a pretty massive stack of sources for you today. We've got clinical protocols from aesthetic medicine. We have these dense molecular immunology reviews that detail the exact behavior of fish allergens and comprehensive dermatology guidelines on allergy testing.
It's a lot of material to get through.
It is. Okay, let's unpack this. Because to understand why a doctor is suddenly interrogating your seafood diet at a cosmetic appointment, we first have to look at what's actually inside the syringe.
Yeah, we really need to define the biological payload first. So we are talking about polynucleotides.
Often abbreviated as PN, right?
Right, PN, or sometimes PDRN, which stands for polydeoxyribonucleotide. Basically, these are highly purified bioactive compounds.
And when we say compounds, we mean DNA.
Literally fragments of DNA. They are surgically cut down to very specific lengths, usually between 50 and 2,000 base pairs.
And these fragments are extracted from the milt, or, the sperm cells, of Pacific and Atlantic salmon, or sometimes trout.
Right.
But I guess the obvious question is, out of all the biological sources on Earth, turning to marine life to fix human wrinkles seems, I don't know, entirely random. But there has to be a structural reason for it.
Oh, there absolutely is. It basically comes down to molecular geometry. Salmon DNA actually shares roughly 95% structural homology with human DNA.
95%.
Yeah, 95. It is elegantly similar to our own genetic building blocks. So when these purified DNA fragments are injected into the dermal layer of your skin, they don't just sit there, they act as messenger molecules.
Right, because, a traditional dermal filler like hyaluronic acid is basically just structural scaffolding, right?
Exactly. It just plumps up an area mechanically, it holds on to water.
But these polynucleotides are biostimulators. They're actually changing the behavior of the tissue itself.
Yes. They actively bind to very specific receptors on your cells. Specifically, they're called the adenosine A2A receptors, which are located on human fibroblasts.
Okay.
And the mechanism here is crucial. When the DNA fragment docks into that A2A receptor, it triggers a massive metabolic shift inside the cell.
Like flipping a switch.
Exactly like that. It downregulates inflammatory cytokines and simultaneously stimulates the secretion of vascular endothelial growth factor.
Which is VEGF, right?
Right, VEGF. And that whole cascade essentially tells your cells to wake up, start synthesizing fresh collagen and elastin, and literally build entirely new blood vessels.
It's like slipping a new blueprint to the construction crew inside your cells.
That's a great way to put it, yeah.
But here's what I don't get. If the DNA is a 95% match to ours, and it's highly biocompatible, why is fish allergy even a conversation?
Well,
Isn't it like making a pot of coffee and then running it through a really high-grade filter? Shouldn't the coffee grounds, or in this case, the allergen, be completely gone by the time it reaches the syringe?
That is the exact logic the industry uses. And to push that coffee filter idea further, the manufacturing process actually goes through extreme lengths to do just that.
Right, the purification.
It's a very intense multi-stage process. It involves cell lysis, which brutally breaks open the sperm cells. Then there's enzymatic digestion, multi-stage chromatography to separate all the molecules by their weight and charge, and then
Right.
ultrafiltration. The entire objective of all of this is to strip away all the lipids, the cellular debris, and most importantly, the proteins.
Right, because DNA itself doesn't actually trigger a fish allergy, does it? The immune system is basically blind to the genetic material.
Exactly. Your immune system doesn't care about the DNA. It is only hunting for foreign
Oh,
proteins. But here is the protein paradox of this entire field, and it's the main reason screening is so critical. The primary protein responsible for fish allergies is a molecule called parvalbumin.
parvalbumin.
Right. And parvalbumin is, for all intents and purposes, practically indestructible.
Wait, indestructible in what sense? Does it just, like, resist the chemical digestion process you mentioned?
It resists almost everything. So parvalbumin is a calcium-binding albumin protein. Its molecular structure is so tightly folded around these calcium ions that it heavily shields its core.
Oh, wow. So it's like it has its own little armor.
Exactly. Because of that, it is highly resistant to heat, it resists aggressive denaturing chemicals, and it even survives proteolytic enzymes.
And those are these specific enzymes designed to cleave proteins apart.
Right, it just shrugs them off. Its polypeptide mass typically falls somewhere between 5 and 70 kilodaltons. So even with true pharmaceutical-grade purification, which is the absolute highest standard of filtering out those coffee grounds, trace residues of this parvalbumin protein remain a theoretical possibility.
Okay, so because this one specific calcium-binding protein is so insanely tough, the risk of a reaction, however microscopic, is still floating around in the vial,
Exactly.
which means the clinician's very first job isn't evaluating your skin laxity or your wrinkles, it's evaluating how your immune system has historically behaved around a plate of seafood.
Right. Because trace amounts of parvalbumin can survive that gauntlet of purification, the clinical consultation becomes the very first and arguably the most important line of defense. The sources really emphasize that a detailed medical history is the ultimate diagnostic tool a doctor has before moving forward.
But, I mean, a medical history is just a conversation. And an allergy isn't a single uniform event. Like, some people get a rash from shellfish, while others might get severe stomach cramps from eating salmon.
Yeah, it varies wildly.
So a doctor has to map out exactly what kind of biological pathway your body uses when it encounters fish protein.
What's fascinating here is that there are actually two entirely distinct pathways that a fish allergy can take. And the doctor is carefully listening for clues to determine which one your immune system relies on.
Okay, what's the first one?
The first is Ig-mediated. This is the classic immediate allergic reaction that involves immunoglobulin E antibodies.
Right. If your body uses the IgE pathway, it basically recognizes the parvalbumin protein and just immediately releases a massive flood of histamine.
Exactly. So you're looking at rapid onset symptoms. Acute urticaria, which is hives angioedema, respiratory asthma, or even fatal anaphylaxis.
So that's the immediate alarm bells ringing reaction. Your throat closes up.
Yes. But the second pathway is a bit more insidious. It is non-Ig mediated, and the immunology sources highlight a severe condition called FPIEs.
FPIE. That stands for food protein-induced enterocolitis syndrome, right?
Correct.
And since enterocolitis affects the gut, that means the reaction is localized entirely differently than, like, hives, and probably operates on a completely different timeline.
Yeah, it's a delayed gastrointestinal hypersensitivity. It doesn't happen while you're still sitting at the dinner table.
When does it hit?
Typically 1 to 3 hours after exposure to the fish protein, the patient experiences profuse, repetitive vomiting, severe lethargy, and extreme pallor.
Oh, that sounds awful.
It gets worse. In acute cases, the systemic fluid loss from the vomiting is so severe it can actually lead to hypovolemic shock.
Wow. So your medical history either points to the immediate airway threat of anaphylaxis or this delayed severe shock threat of FPIEs in the gut.
Right.
So if a patient's chart reveals a severe history of either of those reactions to fish, the polynucleotide treatment just has to be an absolute contraindication, right? It's a hard stop.
Oh, absolute hard stop. Because the risk of your immune system finding even that microscopic trace amount of parvalbumin is just too high to play with.
Makes sense. But the reality of running an aesthetic clinic is that medical histories are rarely that black and white.
Oh, definitely not. People have terrible memories.
Right. You often have patients who come in and say, like, I think I broke out in a mild rash after eating a tuna roll like 10 years ago, but I'm not really sure.
Exactly. So they don't have a hard stop on their chart, but they aren't totally in the clear either.
Which means the doctor isn't just going to guess with your face. If your medical history flags a potential mild allergy, they have to move to specific clinical testing protocols to see exactly how your immune system behaves in a highly controlled environment.
Let's break down that diagnostic toolkit because it's pretty extensive.
Huh.
The go-to test for identifying those immediate IG-mediated reactions is the skin prick test, or SPT.
Right, the classic allergy test. So is a skin prick test like a quick interrogation, while a patch test is more of a slow burn stakeout?
I actually love that analogy. Yes, the skin prick test is absolutely the quick interrogation. The clinician places a tiny drop of the suspected allergen, in this case, either a raw fish extract or a specific parvalbumin marker directly on your forearm.
Okay.
Then they use a tiny lancet to gently prick the skin right through the drop, which introduces the protein directly to the mast cells sitting just below the surface.
And if you have an IgE-mediated allergy, those mast cells basically freak out and degranulate immediately, right?
Exactly.
That's nice.
The localized histamine response causes an itchy red bump-a-wheel to appear within 15 to 20 minutes. Very fast. But there is a massive logistical hurdle for the patient here. To get an accurate result on that skin prick test, you absolutely must stop taking any antihistamines for 48 to 72 hours prior to the test.
Oh, man. And I read some clinics even require a full 5-day washout period.
Yeah, they do, and it is incredibly frustrating for patients, especially if it happens to be during allergy season.
I can imagine.
But the science demands it. Because if you're taking a drug specifically designed to block histamine receptors, your mast cells literally can't form the red bump,
Right, you get a false negative.
essentially silencing the witness before the interrogation even begins.
Okay, so if the skin prick test is negative, but the doctor still suspects something based on your, murky history,
Yeah.
I'd imagine they escalate to an intradermal test, like injecting the allergen slightly deeper into the dermal layer to force a stronger interaction with the immune cells.
That is the standard escalation for IgE testing, yes. But you pointed out earlier that FPIES and contact dermatitis are delayed reactions. Poking the skin for 15 minutes won't tell you anything about a delayed response.
True, because if you're looking for a delayed hypersensitivity, you are waiting on the skin's T cells to react, not histamine. And T cells take hours, if not days, to actually migrate to the site and mount a localized defense.
Right.
So you'd have to leave the allergen on the skin for days to see if they even show up.
Which brings us to the stakeout part of your analogy, patch testing.
Okay, how does that work?
The doctor applies 20 to 40 different potential allergens into small disc patches. Each one is about 1 centimeter in diameter. These patches are securely taped to your back.
All over your back.
Yeah, in rows. And here's the kicker. They must be left completely undisturbed for a full 48 hours.
Leaving medical tape on your back for 48 hours without showering or heavy sweating sounds brutal, especially for someone who, works out every day.
It is definitely a commitment.
But I guess if the goal is to trigger a slow-moving T-cell response, you really can't risk washing away the evidence before the cells even arrive.
You have to let the biological process play out. So at the 48 to 72-hour mark, you finally return to the clinic. The doctor removes the tape and carefully reads the skin, looking for delayed localized inflammation, redness, or even blistering under specific discs.
Wow, okay, but what if someone has, severe eczema, and you can't accurately read a skin test because their skin is already perpetually inflamed and red?
It happened.
Or what if they're on critical antihistamines or immunosuppressants that they absolutely cannot stop taking for a washout period?
That's a great point. If skin testing isn't biologically viable for whatever reason, the protocol shifts to blood testing.
Okay, so drawing blood instead of poking the skin.
Right. The doctor draws blood and analyzes the serum for specific circulating IgE antibodies. The dermatology guidelines frequently highlight the immunoCAP test for this.
ImmunoCAP, I've heard of that.
It is a highly sophisticated diagnostic tool. It can actually screen for up to 107 different allergens simultaneously. And in this context, it's specifically hunting for those stubborn parvalbumin markers floating around in your bloodstream.
Okay, so let's say you go through this entire gauntlet.
Yep.
You had a murky history. You suffered through stopping your meds. You got the skin prick test, maybe the torturous patch test, and the blood work. The results finally come back, and your doctor concludes that you don't have a severe, life-threatening allergy, but you do have a confirmed mild intolerance to fish proteins.
Right.
How does an aesthetic provider handle that?
Well, once formal allergy testing rules out the severe anaphylactic threats, aesthetic clinics employ a final, highly practical safety net before touching your whole face.
The test spot.
Yes, the in-clinic test spot protocol.
It's essentially the biological equivalent of testing a harsh new laundry detergent on the inside hem of your shirt before you wash your entire wardrobe in it.
That's exactly what it is. It is a controlled exposure. 2 weeks before the full facial protocol is actually scheduled, the provider injects a tiny subcutaneous amount of the actual polynucleotide gel into a very discrete area.
Like where?
Usually just behind the ear or right along the jawline.
And then what? You just wait.
Yep. You sit in the waiting room for a full hour to ensure there is no acute, immediate reaction. Once you're cleared at the 1-hour mark, you go home with emergency contact information.
And then you just watch the injection site like a hawk, right?
Right. You watch it for any delayed T-cell immune response over the next few days. If that test spot remains totally calm, the provider can finally proceed with the full face treatment.
It provides a massive degree of clinical confidence. I get that. But this entire protocol assumes the patient is actually willing to use a fish-derived product in the first place.
Ah, yes, the lifestyle factor.
Right. Here's where it gets really interesting. What happens if they fail the test spot? Or what if they simply maintain a strict vegan lifestyle and refuse to have an animal-derived product injected into their face, regardless of how insanely purified it is?
That's a huge demographic.
Are those patients just like locked out of this entire category of regenerative tissue repair?
Not anymore. The industry has actually engineered a pivot for exactly this demographic. For patients with severe parvalbumin allergies, uncontrolled autoimmune diseases, or strict vegan ethics, the alternative is vegan PDRN.
Vegan PDRN. So where do they get the DNA from, if not salmon?
Manufacturers have actually found ways to extract highly compatible polynucleotides from plants. Specifically, they're using the peony flower or ginseng root.
Wait, really? So they are taking plant DNA and using it to mimic salmon biology?
Yes.
And it still acts as a messenger molecule. It still binds to those exact A2A receptors on human fibroblasts and triggers the exact same cascade of collagen production and angiogenesis.
It does. The cellular mechanism is designed to be completely identical. And the best part for these patients is that it completely bypasses the parvalbumin protein threat because obviously there's absolutely no marine protein in a peony root.
It is an incredibly elegant workaround. I mean, problem solved.
It is. However, the clinical context is really important to mention here. We have decades of longitudinal safety and efficacy data for salmon-derived DNA in medicine.
Right, because they've used it for burn victims and joint repair for years.
Exactly. But the clinical data pool for plant-derived PDRN is currently much smaller. It is rapidly growing in the medical literature, but it's just not as established yet as the marine version.
It really shows how far the science has to stretch to accommodate the human immune system. While social media casually tosses around the phrase salmon sperm facial as if it's just a trendy spa day alongside a cucumber mask, the clinical reality is heavily layered.
Oh, deeply layered.
You are dealing with a medical treatment that relies on multi-stage protein purification just to strip away everything but the genetic building blocks. It requires these deep investigative medical histories to separate a mild sensitivity from dangerous FPIEs or IgE reactions.
And it relies on incredibly precise immunological testing, from timing a 15-minute mast cell degranulation to enduring a 48-hour no-shower patch test for T cells to targeted immunosap blood work.
All of this effort is deployed for one single goal: to ensure that when those messenger molecules are finally slipped past the security system and injected into your dermis, your body receives them as a blueprint for healing, rather than a threat to be attacked.
It's quite the biological heist when you think about it.
It really is.
And, it leaves you with a really fascinating concept to ponder. We know that these purified DNA fragments act as messenger molecules to trigger human cellular repair, and that our immune system acts as this fierce gatekeeper looking for foreign proteins.
Right.
If we are successfully training our bodies to accept and decode genetic building blocks from marine life and plants to heal our own skin, what other cross-species biological blueprints might we harness in the future?
Oh, wow.
And as we inject more of this bioengineered DNA, how might our own immune systems eventually evolve or adapt to communicate in entirely new biological languages?
Now, that is something to think about next time you look in the mirror. Thanks for joining us on this deep dive.